So what is telemedicine all about, and how does it impact you? Well, telemedicine or telemental health is the use of information and telecommunications technology to provide medically and psychologically necessary services across distances. Overall, telemedicine makes the exchange of medical information between providers and/or providers and patients through electronic means easier. Medical information includes, but is not limited to, medical images, output data from medical devices, and verbal diagnostic information. The telemedical interaction may involve a variety of technologies, including live two-way audio and video modalities. For example, clinical video teleconferencing or VTC. Telemedicine interaction occurs between patients at the originating site and providers at the distant site. Telemedicine may be conducted in many clinical specialties, including, but not limited to, mental health and primary care. Synchronous telemedicine service is the exchanging information between two parties at the same time through audio and video telecommunication devices. One common example would be video teleconferencing or the VTC. Clinical VTC supports the delivery of healthcare at a distance by sending digitized video images between two or more locations when both parties are present. Providers and/or patients can exchange medical information via clinical VTC for obtaining an expert opinion, diagnostic support regarding care of a patient, and direct patient care. Asynchronous or store and forward telemedicine encounters means transmitting medical images or information in one direction at a time via electronic communications. Teleconsultations commonly involve radiology, pathology, cardiology, and dermatology. Teleconsultation supports the delivery of healthcare at a distance. It includes electronic medical information and digital images or video sent over a secure connection. It occurs between two healthcare providers to obtain an expert opinion or diagnostic support regarding the care of a patient. In the process of teleconsultation, the remote consultant does not interact directly with the patient. Instead, the consultant prepares and transmits comments, recommendations, or an official interpretation back to the referring provider for their review and consideration. A teleconsultation is not a traditional patient referral in which patient care is transferred to the consultant. Interactive telecommunications systems are multimedia communications methods that include, at a minimum, secure audio and video equipment permitting two-way, real-time service or consultations. This includes smartphones, tablet computers, and personal computers equipped with the necessary camera and software to enable two-way encrypted real-time audio and video interaction, as well as video conferencing and telemedicine systems. The originating site is the site where the beneficiary is located at the time the services are provided via an interactive telecommunications system. The originating site must be either where a TRICARE authorized individual provider normally offers professional medical or psychological services, in other words, the provider's office, or a TRICARE authorized institutional provider, or a patient's home or other secure location as outlined in the policy. The distant site is where the physician or practitioner providing the professional telemedicine service is located at the time the services are provided. A telepresenter is an individual at the originating site, when the originating site is other than the patient's home, who has the necessary skills, training, and/or clinical background to operate the telemedicine technology and facilitate examinations under the direction of the provider at the distance site. This may be a licensed practical nurse, LPN, registered nurse, RN, trained medical technician, or other trained medical personnel. The nurse or trained personnel may use a device connected to a telemedicine system such as a digital stethoscope or otoscope in order to provide diagnostically relevant imagery, sound, or other data or information about the patient to the distant provider in real time. The following technical requirements, criteria, and limitations are required for telemedicine. Video conferencing platforms. Video conferencing platforms used for telemedicine services must have the appropriate verification, confidentiality, and security parameters necessary to be properly utilized for this purpose and must meet the requirements of the Health Insurance Portability and Accountability Act, or HIPAA, privacy and security rules. Connectivity. Telemedicine services provided through personal computers or mobile devices that use internet-based video conferencing software programs must provide such services at a bandwidth and with sufficient resolution to ensure the quality of the image and/or audio received is sufficient for the type of telemedicine services being delivered. Telemedicine services shall not be provided if this functional requirement is not met. Privacy and security are essential to telemedicine, which is why we have strict guidelines. The following guidelines, while technical, help ensure the privacy and security of telemedicine services. Providers will ensure audio and video are secured using point-to-point encryption that meets recognized standards. Providers shall not use video conference software that allows multiple concurrent sessions to be operated by a single user. Protected health information, or PHI, and other confidential data will only be stored or backed up to secure data storage locations that have been approved for this purpose. Cloud services unable to achieve compliance should not be used. Conditions of payment for synchronous services are the following. For TRICARE payment to be authorized, interactive telecommunication systems permitting real-time audio and video communication between the TRICARE authorized provider and the beneficiary must be used. Both the patient and provider must be present on the connection and participating. Also, TRICARE allows payment for asynchronous telemedicine services which, under conventional healthcare delivery, do not require face-to-face or hands-on contact between patient and provider. To be authorized, interpretive services must be provided by the consulting provider to the referring provider. Distant site requirements include the following. For TRICARE payment to be authorized, the provider must be TRICARE authorized, and the service must be within a provider's scope of practice under all applicable federal and state laws for jurisdiction in which the services are both provided and received. For services provided outside of the United States, the services must be within a provider's scope of practice under all applicable host nation requirements. The beneficiary is responsible for any copay or cost sharing. The copay amount will be the same as if the service was provided without the use of an interactive telecommunications system. Originating site facility requirements are: for covered synchronous telemedicine services, the payment for the originating site facility fee will be the lowest of these three choices: the originating site facility fee, the negotiated rate, or the billed charge. The facility fee for the originating site is updated manually by the Medicare Economic Index, or MEI. Annual updates to the originating site facility fee will be included in the annual updates of the CMAG file, or TRICARE contractors will implement these updates in accordance with the annual CMAG updates. Also, payment of the originating site facility fee is limited to facilities where an otherwise authorized TRICARE provider normally offers medical or psychological services, such as the office of a TRICARE authorized individual professional provider, for example, a physician's office, or a TRICARE authorized institutional provider. Facility fee payments will not be made when a patient's home is the originating site. Outpatient cost share rules will apply to the originating site fee. Please be aware that, to be considered for coverage under TRICARE, the beneficiary must be present physically when a Christian Science service is rendered. Services otherwise excluded under the TRICARE program are also excluded from being delivered via telemedicine. Audio-only telephone services do not meet the definition of interactive telecommunication systems and are excluded. Facility fee payment is excluded when the originating site is the patient's home or location other than where the authorized TRICARE provider typically provides services, for example, an office or clinic. TRICARE's recently revised telemedicine benefits allow the patient's home or other secure location to be an originating site for telemedicine services. TRICARE covers services provided from a beneficiary's home only if the video technology component of the location meets the standards of the American Telemedicine Association, or ATA. Allows telemedicine for any otherwise covered TRICARE benefit when such services are deemed medically or psychologically necessary and appropriate. Allows payment of telemedicine services at the same rate as the same service provided without telecommunications services, and directs contractors to adhere to clinical specialty and telemedicine practice guidelines, as well as licensure regulatory requirements of the jurisdiction in which the patient and provider are located. Technical requirements for telemedicine sessions include the following: a minimum bandwidth of 384 kilobytes per hour with H.263 video encoding, or 256 kilobytes per second with H.264 video encoding, or the technical equivalent. A monitor with a display of at least 16 inches diagonally. This excludes most tablets. All Internet protocol sessions must be encrypted unless they are conducted entirely on a protected network or using a virtual private network connection. Originating sites, for example, the physician's office, conducting more than 50 visits per year must have cameras with pan, tilt, and zoom capabilities that can be remotely controlled from the distant site where the servicing provider is located when providing telemedicine services. Video chat applications like Skype or FaceTime may not meet all technical requirements. These applications should not be used unless appropriate measures are taken to ensure they meet requirements. The appropriate business associate agreements, if necessary, are in place to utilize such applications for telemedicine. Audio-only phone services are not covered under TRICARE's telemedicine benefit. Please review the TRICARE Policy Manual, Chapter 7, Section 22.1 for more information. TRICARE requires telemedicine providers to be licensed to practice in the state where the services are being provided and are being received. Verify providers and patient identity. Establish an alternate plan for communicating with the patient, for example, by telephone, in the event of a technological failure. Ensure that transmission and storage of data is conducted over a secure network and is compliant with HIPAA requirements. Document provider and patient location, city, state, and zip codes in the medical record as required for the appropriate payment of services, and bill with the appropriate CPT and HCPCS codes and modifiers. For more information on telemedicine services, You can call our toll-free line at 866-773-0404 or visit our website, www.tricareforyou.com. According to one study by Health Data Management, nearly 75% of all U.S. consumers say they would use telemedicine. Use is growing, and telemedicine is especially important for rural areas, the elderly, and the homebound. This has been the WPS Military and Veterans Health Division TRICARE webinar on telemedicine. Just a reminder that the recording of this webinar will be available for viewing on our website, tricareforyou.com. Thank you for spending the time with us today, and have a great day.